Hi, I'm Dr. Jonathan Jassey, a board-certified pediatrician practicing in Belmore, New York. Diagnosing influenza is largely based on symptomatic presentation, but diagnostic testing can provide further insight into the strain and subtype that the patient has, enabling the CDC and other public health agencies to understand what the public is suffering from, guiding current and future public health initiatives and influenza vaccine development. Nasal swabbing can be used to obtain a sample that can be sent for laboratory testing. However, performing this procedure on infants and young children is distressing and uncomfortable for patients and their parents, and can be difficult to perform for practitioners, resulting in potential false negative results. Accuracy of samples is critical. The risk of a false negative from insufficient sample can impact treatment and reporting. At our practice in Belmore, we have been trialing the CLEARinse nasal aspirator, a handheld electric nasal aspirator that irrigates and aspirates the nasal passages using 3 cc's of saline and regulated suction and flow pressures. These suction and flow rates meet both the American Academy of Pediatrics and the American Respiratory Council guidelines for safety and efficacy. CLEARinse can be used not only to provide relief to patients, but to obtain a high-quality sample for laboratory testing. In a comparative study done in 2010-11, CLEARinse wash aspirate demonstrated an 18.7% difference, 81.25% versus 100%, in detecting true positives over the nasopharyngeal samples. Additionally, the CLEARinse method was preferred 3-to-1 by parents and practitioners. A growing number of pediatric practices are using CLEARinse successfully with their patients to provide relief for nasal congestion and to obtain nasal wash samples. It also can potentially be billed using procedure code 30210, displacement therapy, for reimbursement. CLEARinse is less traumatic and far superior to other competitive products. It can clear the nasal passageways effectively and safely. It can help the provider get a better assessment of the lungs once the upper airway congestion is cleared. In addition, it can help get accurate results for RSV, influenza, and other respiratory viruses being tested.